Hello, and welcome to our session of Milk Minutes. As many of you may know, we conduct Milk Minutes every fourth Monday, live streams on our Healthy Start Facebook page. So before I dive into what this month's topic is going to be, I do want to give a brief overview about what Healthy Start Center for Urban Breastfeeding is and what we do. So the Center for Urban Breastfeeding is Healthy Start's initiative to increase breastfeeding rates among Black families in Allegheny County. Whereas our Milk Minutes is our community education series that we can talk about a variety of different hot topics that the public would like to hear. And the good thing about it is you do not have to be registered into our program to participate, to listen into our Milk Minutes. So without further ado, I'm going to jump into this month's topic. And if you don't know, October is SIDS awareness, and we are going to talk all about safe sleep. We have Chastity Everett with us. Hi, Chastity.
Hi.
Can you give us a little brief description about what you do, who you are? Let the people know.
Okay, so as you mentioned, my name is Chastity Everett. I'm the health educator and outreach manager for Healthy Start. So one of my roles at Healthy Start is, of course, to do outreach events. And so connecting with the community about the services we offer at Healthy Start, how to sign up for those services, and how you qualify for services. Because depending on what service you're interested in, we do only service certain zip codes. So I'm able to tell you that on the spot at those outreach events, what you may qualify for.
Okay, well, I'm glad that you was able to join us today. So I know a lot of people don't know exactly what safe sleep is. So can you tell us what safe sleep is?
So safe sleep is putting your baby to sleep in ways that can help protect them from danger, like choking, suffocation, and that's not being able to breathe, and sudden infant death syndrome, also called SIDS.
Yes. So SIDS, I mean, is a scary thing. I know that unfortunately, each year in the United States, thousands of babies die suddenly and unexpectedly. And the death result is unknown, So if you don't know exactly why it's happening, that it can be a little intimidating. And I know that from the age of like when they're first born to all the way into 1 year, that SIDS is a big risk for them. So like, how can we prevent that, or what are the steps to preventing SIDS?
So there's actually 12 steps. It sounds like a lot, but when I tell you what those 12 steps are, a lot of people, you're probably already doing these things. So the first step is to always put the baby on their back. So always make sure that you put the baby to sleep on their back. That there's a firm and flat mattress. So it needs to be hard and solid, sort of like when you're in the hospital and they bring your baby in and that little, what they bring the baby in from the hospital, that is a firm, solid space. So you can feel it and get used to it when you have your baby, and that's the way it needs to feel. Breastfeeding. So breastfeeding has been shown to reduce the occurrence of SIDS by 50% because breastfeeding improves the immune system, promoting brain growth, and even reducing reflux. So breastfeeding is a huge factor on reducing SIDS. Room sharing. So you can share a room with your child and they can have their own sleep space, but you want to try to share the room. So if something goes on or if the baby starts coughing, you're able to hear the baby. Of course, when your child gets 16 or 17, they're not going to want to share a room with you and they're going to want their own space. But until then, you can room share. So take advantage of it now, because when they get older, they're not going to want to do it.
Right.
Remove everything from the crib. So sort of like how we decorate our bed with all those pillows and all those unnecessary things. And then every night before we go to bed, we have to remove all those things so that we can sleep comfortable and safe. The same for your baby's sleep space. No bumpers, no pillows, no blankets. It needs to be a bare space. And I know decorating your baby's room is exciting and fun, but take a picture of it and then take it all down. So take it all down before your baby goes to sleep. A pacifier also reduces SIDS. So if you are going to introduce a pacifier, we ask that you wait at least, if you're going to breastfeed, that you talk to our Center for Urban Breastfeeding is one of our programs on the best way to do that if you're going to introduce a pacifier to the baby. Not smoking. So we strongly encourage you not to smoke after you have your baby. But if you are a smoker, I do know that some habits are hard to break. So when you go outside to smoke, even though we think perfume takes away the smell of smoke, it doesn't take the smoke out your clothes. So if you have your little one and you go out to breastfeed, just making sure, I tell people to keep a sweatshirt or something by the door and put that on to go out to smoke your cigarette. When you come in, wash your hands, rinse your mouth out, and take that sweatshirt off and put it back where it needs to be, because it's almost like frying chicken. When I fry chicken and I burn it, I'm able to open the windows and let the smell out. Your baby's not able to say, hey, can you open a window? I can't breathe because of the smoke. So it's important to make sure you're washing your hands and rinsing your mouth out and changing your clothes. And not overheating your baby. You carried your baby for 9 months. So if you're comfortable, your baby's comfortable. I know sometimes as parents, we think my baby might be a little chilly, even though I'm not. You carried your baby for 9 months. If your house was 64 degrees for that 9 months, your baby's school was 64 degrees. So you don't need to turn it up higher. You want to make sure that you're keeping all your baby's medical appointments and all your medical appointments. My son, when he was born, he had severe asthma. Originally, they just call it inability to breathe, or they didn't give it that asthma name at first, or respiratory distress. But because we went to those regular visits at around 6 months, they discovered he had asthma and needed an inhaler so that he can breathe. So you want to make sure you're keeping those appointments, and also keeping appointments for yourself, because sometimes after we have a baby, we become fatigued and we get tired more often. And maybe the doctor can say, hey, your iron is low, so we need to give you an iron supplement or something so that we can pep you up a little bit. So making sure that we're noticing those small things. Caution when you're buying things. Anybody will sell you anything that you're willing to buy.
Yes.
All you need for your baby is a firm, safe sleep space. I know some parents, there's a thing that you can buy where if the baby moves, the sensor goes off and it's supposed to wake you up. It probably wakes the whole house up. And that can actually scare your baby, because the baby hears this buzzing sound. It's like, oh my goodness, I'm not supposed to be moving. So you want to make sure that, you read things and make sure they're necessary for you to have. And you want to put safety first. Tummy time increases strength. So you want to place your baby on the floor, on their tummy, and allow them to use those muscles, those hip muscles, those arm muscles, just so they can learn how to, I call it baby yoga, just so they can learn how to do their own little thing in their own space. And spread the word about safe sleep. So talk to your friends, talk to your family. Sometimes it can be hard talking to a grandparent because they feel like, I did it with you. There's nothing wrong with doing it this way. But when asthma first came out, it was said that you needed just the inhaler. As years went on, they discovered that the inhaler is ineffective without the spacer. So as we grow and develop, we learn new things and we learn better ways of protecting ourselves. And it's important too to have your kitchen table. And what I consider your kitchen table is a support team of people who can support you through giving birth to your child and raising your child. So having your support table. So we all have that friend who's up till 5 o'clock in the morning watching Netflix. So
Yes.
if you're having that difficult time doing that night feeding, then you can call that 5 o'clock in the morning friend who's up watching Netflix. We all have that one friend who just is in love with the gym and she's up at 5 a.m. because she got to be there by 5:15. So I can call her early in the morning because she's up and she's able to support me at that time. Lean on your spouse for support too. So a lot of us, when we're dating or married, we're the people who go to sleep I go to sleep at 8, my significant other's up till 2 in the morning. So he would be the one doing the night feedings so that I can sleep and get the proper rest. So it's about looking at what you have and making sure that you have support in your space.
Definitely. You touched on some really good points. And when people hear it's 12 steps, they think like, oh my God, like that's a lot. But when you really think about it and it's broken down, it just flows. It's not really that much at all. And I think that you made a good point about breastfeeding can kind of reduce that. And I think it's important to know that when you're breastfeeding, your baby is getting up to eat every like 2 to 3 hours. So that really helps too. Being educated, because a lot of people do feel as though like, oh, I smoked outside, I sprayed myself down, I'm quite okay. And it's like, no, it's trapped into your clothes, it's lingering. So I think that's a good point too. So what about my girlfriend. She's so excited about her baby, and she has this like Tempur-Pedic pillow top mattress for his crib. What do you think I should tell her?
So I think that I would introduce it as a you thing. So hey, when I had my kids, I didn't really know a lot about SIDS, and I'm thinking about taking a safe sleep ambassador training through Cribs for Kids. Can you take it with me? Can we take it together virtually? Because I want to know if you can give me some feedback on some of the things I'm hearing, because I know you're a new mom, just to let me know if this seems factual. So making it more about you and making it seem like you need her support.
Okay, I like that idea because you don't want to just say, "Girl, you better take that out. He don't need
Mhm.
that. That's not safe sleep." People get offended thinking that you got all the answers. So I think that's a good way to say it.
Mhm.
So what about other ways? Is there other issues that cause sudden death between the baby outside of SIDS? I know
So
that.
So to do a little story sharing, unfortunately, a story was shared with me with a mom who went to sleep on the couch with her baby. And throughout their nap time, the baby went in between the cushions. So when mom woke up, the baby had passed away because the baby was unable to breathe.
Oh,
And
goodness.
sometimes, we think that, oh, we can feed our baby in our bed because we're so tired. And feeding your baby with a pillow prop behind you in your bed will not work. You will fall asleep. So I suggest getting the most uncomfortable chair that you have, the hardest wooden chair in your house, and you sit in that chair and do your feeding, and you'll be looking forward to putting the baby back in their space and getting back to a comfortable space.
Yes, I think that's a good point because even in our breastfeeding 101s, we talk about some of the latching positions, and
Mhm.
saddling is a position that a lot of moms do utilize. And I try to make sure that I emphasize the importance about safe sleeping because, like you said, you're already so tired. You're
Mhm.
sitting there feeding baby's probably falling asleep. So it's easy to fall asleep and cause the issue. I know that mom probably felt terrible when she woke up because it's something that could be so simple to, prevent. So, what about if someone doesn't really have a place for the baby to sleep? If they're like going through some transition, they're maybe not have the finances. Is there resources for the participants to go and get a place for the baby to sleep?
So I want to introduce that when you go to your prenatal visits, there is something at UPMC hospitals that's called a visit summary. And in that visit summary, it talks about what you and your doctor talked about, what the next steps are to your treatment, whatever that is. So in that visit summary, you want to mention to your doctor, I don't have a safe sleep space for my baby. Can you give me some recommendations on where I can get one? And you want to make sure that's documented in your visit summary. If you're not able to get that level of support from your hospital, we do offer safe sleep spaces here at Healthy Start. The process is you would have to take the ambassador training. You would email me the certificate. I would send you 2 surveys that you have to complete. And then we can either schedule a delivery of that safe sleep space and sleep sack or schedule a pickup so that you can come in and pick it up.
That's great. So, do they reach out to do they have to be enrolled in Healthy Start? It can just be a regular community member.
So it can be a regular community member, but I encourage people who can hear my voice. I encourage you, if you are able to learn about Healthy Start and to enroll in Healthy Start, because Healthy Start can be a part of that kitchen table that I talked about, that support network. Because we have the CUB, the Center for Urban Breastfeeding. We do an Edinburgh assessment to see if you're experiencing postpartum depression. We have community health workers who stay in contact and can help you get formula if you choose not to breastfeed, or help you get diapers, or if your lights are getting turned off, can support you with doing applications to get assistance.
Okay, I like that. And another thing, because I know safe sleep is like a big topic. Um, what about swaddling? So if you are swaddling your baby, like how long do you know when to stop swaddling? If it's safe, is there any risk with that? So is there a reason why you should stop swaddling your baby?
So first, you want to make sure that you know how to properly swaddle. Because some parents swaddle and they don't do it to where it's snug enough and it starts to unravel and untighten. So talking with your baby's PCP, talking with your doctor while you're pregnant or your nurses, and learning how to properly swaddle. And we also have nurses here at Healthy Start who work with our programs, and our community health workers can support you in learning the proper way to swaddle.
Okay. And also I wanted to say, I know that like if you do swaddle, that if the baby is able to turn, then it's probably time to like maybe not swaddle them anymore, because you don't want them to like turn on their stomach while they're swaddled
Right.
and they can't, and they're suffocating at that point,
Right.
you know? So I think that is, I read that recently, so I think that's a good point too. I think we touched base on a lot of good topics. I received so much information about the 12 steps of safe sleep, what SIDS is, bringing awareness to that, the different forms of sudden unexpected deaths. I think this is really important to bring awareness to it, make sure that we emphasize the importance of safe sleep, making sure baby has their own place to lay down, be comfortable. Like Chastity said, we do have the resources for you to have a pack and play if that is something that you need. So please reach out to us. We are here to help you. So please like, share, and make sure you come and join us again next Monday at 6 o'clock. Thank you for
Thanks for
watching.
having me.